let's start. My name is Roland Assaf. I'm a Med 1 student at AU. I'll be presenting this presentation on opioids entitled the Opioid, and you'll see why in a while. So this presentation is part of Lamsa's Wednesday webinar series. For those of you who are new, Lamsa is a local NGO who aims to spread a healthy awareness and educating the youth on drugs, and well-being and mental health, so that basically can live a healthy life. This meeting is, and you can follow us on social media in case you want to know more about the association, the NGO. So let's start. All right. So brief index. What I'll be talking about. Simple definition. We'll see how it all started. The mechanism of action of the drug, the type of drugs, how they can lead to addiction. And we'll end with on a positive note, and we'll talk about the treatments. So what are opioids? Well, basically, opioids are drugs, a family of drugs. They can be natural, synthetic, or semi-synthetic, that act on the opioid receptor nerve cells in the body, in the brain or the spinal cord, and they reduce the intensity of pain signals, so that we don't feel pain anymore. So these are a few characteristics. These are narcotics. That means they can cause numbness and reduce pain. In opioids, we have a group called, which are all the natural and semi-synthetic opioids. They're extremely addictive, used as medication or recreational drugs. So how did they all start? It goes back 400 BC before Christ. It's in Sumerians, Minoans, Greeks, and Egyptian civilization, which are around the Mediterranean, that found that this opium poppy plant was actually had some benefits, and it was even prescribed to treat asthma, stomach illnesses, and bad eyesight. And then from there, it spread to the rest of the world. The Opium Poppy Control Act of 1942. So composition. So basically, once they extract this plant, it goes through a series of reactions, chemicals to it, to mainly extract three components. More as a recreational drug, or modified so that they can be used as medication. Synthetically, and this has an advantage that lab technicians and scientists can actually position or the chemical structure of this drug and be able to modify its function so that we can have the best treatment. All right, so what's the mechanism of action? Well, basically, they act on the opioid receptor sites in the central nervous system. So this is present can be present presynaptically or postsynaptically on neurons in the brain or spinal cord. So let's say here you can see on the image that morphine binds to its receptor, and when it does, it actually stops the entry of calcium into the cell, in the presynaptic cells. And when this happens, without calcium, the vesicles cannot fuse in the membrane and cannot release the neurotransmitters in the synapse. So no neurotransmitter release, and they won't bind to the postsynaptic cell, and the message won't be transmitted. So no message, no pain. All right, and they can also act synaptically on also opioid receptors, and by doing so, they hyperpolarize the cell by excreting calcium K plus ions from the postsynaptic cells. So basically, long story short, they just prevent the signal of pain from being transmitted in neurons. For this reason, for this mechanism, they are very used as medication, all right, and especially in pain management. Example are meperidine and petidine. So basically, a lot of patients that suffering from chronic illnesses, such as cancer patients, or even patients that just went out of an operation and they're in a lot of pain, they are prescribed opioids, and this can help them relieve this pain. They can also be used as antitussives. That means they can stop the cough in case you have a use that, and it can be found in cough syrup that usually kids take. They can also be used as antidiarrhea. That means it can stop diarrhea, and this is loperamide or Imodium. I'm sure you've all heard of this drug. And while it might sound weird that an opiate is used to treat diarrhea, this is because it's synthetically made. Scientists were able to modify the structure so that it doesn't cross the blood-brain barrier and doesn't reach the brain. And without reaching the brain, it doesn't cause much harm, and it can't lead to addiction. And it can also lead to be used. Opioids can also be used as anesthetics. And this is an example of it. It's fentanyl, and fentanyl is around 100 times more potent than morphine. And because of this high potency, it can cause hypnotic and put you asleep when it mixes to nitric oxide. All right. Next to the fun part. Let's see why heroin is the main recreational opioid. Okay, so it's the white powder, the white horse, white widow, white lady. It has a lot of names, a lot of street names, but it can actually be found in three main forms. It can be a white powder, which is known. It can be a brownish powder, or as black tar. And this varies by the way is so the process that it goes through. It can actually different forms, and it can be mixed with sugar or starch to make it maybe look easier to use, or like for marketing purposes. And it has a bit. How is heroin taken? It can basically be either injected, snorted, or smoked. Injected is the most used and most known. So basically, they mix it with water and salt and some solute to make it more soluble, and then inject in the forearm or other parts of the body. And it can also be like the white powder can also be snorted or smoked, and these form of small new users and young adults often rely to these methods because first it removes the stigma that society has on drug users that inject drugs, and second, it can prevent the spread of HIV or hepatitis. That's a risk that can be present when users share their needles. So what happens when you use heroin? You instantly get into dreamlike state. So you get into a happy world, a pain-free world. It's an analgesic, hypnotic. So you become sleepy, relaxed, and even before you can laugh and have a good time for a couple of hours. But it has a lot of side effects that we'll talk about later. Right. So what are other opioids? Well, basically, as I said, a lot of medications that contain opioids, and all of these, what they were first created for medication, for medical purposes, can actually be used as drugs by people. So they basically try and take the pills in higher dose that's necessary, or for or they can even crush the pills and snort them or inject them. So basically, any medication that contains opioids can actually be used as a recreational opioid, and this has a lot of consequences on public health, and which I'll be talking about later. So an example of this is codeine, which is known as the recreational drug known as lean. Well, actually, codeine is found in cough syrup, as I said earlier, and some teens, they mix this syrup with soda and candy, and this makes a drink called lean. And then it's very famous. It's getting famous among teenagers and the youth because, and especially pop cultures, because a lot of stars actually post on social media with this styrofoam cup, and it's getting very popular. And a lot of them, unfortunately, don't know that this is actually codeine, which is actually an opioid and can be extremely addictive and dangerous on their health. So, what are some side effects? So, why are opioids dangerous? Well, short term, they can cause flushing of the skin and feel warm. The mouth can be dry. It can cause nausea, muscular rigidity, and constipation. And most dangerously, it can cause respiratory depression. And this happens because they act on the medulla, which is the respiratory system, the part of the brain that controls the respiration, and because it's inhibited by opioids, you basically start breathing more slowly, and can stop the breathing, which can be life-threatening. On the long term, well, this drug can cause physical and physiological changes in the brain. So it causes imbalance of neural and hormonal systems. White matter can be deteriorated, so you lose your ability to function regularly in society. You cannot respond well in stressful situations. Won't be able to take decisions, whether it's in your professional or personal life. And they cause extreme and high degrees of tolerance and physical dependence. So you always need a higher and higher drug higher dose of the drug to reach the desired effect, and which can pose a risk, and can also cause mental disorders such as antisocial social personality disorder, etc. Now, other than the brain, it can affect the lungs. You can have lung complications, sexual dysfunctions, and as I said before, it can transmit. There's a risk of transmission of blood-borne viruses such as hepatitis B and C and HIV. And to tackle this last point, countries in Europe and the US have actually developed or started a needle exchange program, which is basically you can go to centers, specific centers, and you can ask for needles, and at least you'll get new ones and sterile ones. While this might sound controversial, it actually has shown that it can help reduce the spread of these viruses, because you'll be using new needles instead of sharing them. So what happens when you take too much opioids? Well, you get intoxicated, and maybe you can reach overdose. And what are some signs of intoxication? How can you know if someone might be intoxicated by opioid if you see him? So basically, his pupils will be in meiosis, so it will be like a pinpoint. You can see it in the image on the right. So that's opposite to other drugs like cocaine or stimulants that actually cause your pupils to dilate. So if the pupils are constricted, that's probably opioid. The patient or the person will be drowsy. He won't be able to speak well. Won't be able to interact well, so impaired cognition. He'll be hypotensive and bradycardic, heart rate, low blood, and he might also have track marks on his forearm or other part of the body. So that's kind of marks because of the usage of needle. So that might give you a clue that he might be using the opioids or heroin more specifically. But unfortunately, we have a treatment. If someone is intoxicated by opioid, there's a drug called naloxone, lifesaver. It's basically it acts oppositely on opioid receptors that I talked about previously. It's they're opposite than opioids. So basically, they're antagonists. So they act on these receptors, they bind on them, and reverse. That were previously only given in upon hospital admission, but now fortunately we can find them in the market as two form, a Narcan or FZO, which are either a nasal spray or injection device, and that the drug user, his family members or any friends that stays around him can keep in handy in case of emergency. Himself and it has shown that to be life-saving. So now let's talk about public health. So I entitled the talk COVID-19 pandemic because COVID-19 health issue, but there's other stuff too that we shouldn't forget about. And one of them is opioids. In the US, 130 persons die every day from opioid-related drug overdose. So that's more than 47,000 a year. That's a huge number. And from these people, only, or not only, but 15,000 are died because of heroin. So the majority died because of medication that contain actually opioids and not heroin. That's a lot of people don't know about this. And 10.3 million people misuse prescription opioids. So what happens basically, a lot of people actually start by using medication because of injury, because of like they went to the doctor prescribed them opioids, and they take this medication for a while, maybe a month or so, and after that they become addicted to these drugs and they start wanting more. So they jump from using these opioids as medication to recreation, and they can even go to heroin because their prescription is outdated and they can get these medications more. So it is a major public health issue, and yeah, so you can see here the numbers. Around 2 million people had opioid use disorder. So that's a great amount of people. And let's talk about local data. So in Lebanon, cultivated here, they did dismantle 62,000 square meters in 2019. There's more to do. Around you can find a gram of heroin for 50,000 to 30,000 lira. So that's kind of cheap and accessible, we'll say. We've had 200 reports of non-fatal overdose in 2015, and among university students, actually 21% have admitted of using non-medical use prescription drugs, prescription opioids. So that's because in Lebanon, you can actually find some opioid drugs and mainly codeine, and you can get it over the counters that's without a need of prescription. And some people get these drugs and use them for recreational purposes, and without actually being aware that these are opioids and they can have severe consequences on their health. Frequent usage of opioids can lead to its addiction, and that's because it's very rewarding using opioids and has positive reinforcement. You can get addicted in 4 to 8 weeks only after regularly using the drug. And it can cause, as other drugs, physiological and psychological dependence. Well, physiological because of its withdrawal symptoms. So if you go maybe only 24 hours without taking the drugs, or maybe 48 actually, you can feel restless. You have muscle and bone pain. You can have insomnia, watery eyes, runny nose, muscle twitching, and viral reactions. So you'll physically be really very uncomfortable and constantly needing that drug. And this will cause psychological dependence. So you develop an obsession and a compulsive drug-seeking behavior. So the whole purpose of your life will be to get this drug. might drop out of school or high school, or might lose some relationship. You try to forge prescriptions, steal drugs. You do whatever it takes to get your hands on this drug to eventually stop these withdrawal symptoms that you might feel and satisfy your addiction. Now, for people who are aware that they have an opioid and want to stop this, there are treatments and there are pharmacological treatment, opioid substitution therapy. So professionals can prescribe methadone or buprenorphine, which are under supervision and controlled doses. So that way, this patient who wants to recover will stop reducing the drug in a gradual way, so that it can eventually stop this addiction without feeling heavy withdrawal symptoms. And lofexidine is another medication that can help fight withdrawal symptoms. And there's also, of course, behavioral therapies. There's support groups and NGOs that are here to help these people and make sure they're not alone in this path, and they can eventually help them fight their addiction. All right, so that was it for opioids. Thank you for everyone who joined. If you have any questions, stick around. So I hope this presentation was useful and you did have an idea about what opioids are and its public health issue. You can follow us on social media if you have any questions or you might be interested in further events. And yeah, that was it. Thank you. If you have any questions, I'll be here for a while. I just hear a question from Sharbil, who's asking, a lot of people get addicted by this medication. Is there any other option to replace this drug? Well, opioids are used because of very useful pain management and painkillers medications, but these are like very effective and they're mainly used. And of course, doctors try to, as much as possible, to lower the dose and supervise these drugs when they're taken. But sometimes patients overuse them. And Dr. Zaina Mkazer is saying that we actually have the needle program in Lebanon. I didn't know that, and it's NGO Menhara who delivers the needles. So that's useful to know. Thank you for this info.